This is the Second Chance at Health podcast. I'm your host, Dr. Brad Hassig. Come join me as we remove confusion from the hottest health topics by discussing the latest research, along with what we've seen with thousands of our patients and amongst our community, family, friends, and people all over the nation and world. Let's dig in. Hey, this is Dr. Brad Hassig with the Second Chance at Health podcast. Coming to you today with episode number 18, Feel Fabulous This Fall. And this is going to be part one of a multi-part series that I'm going to do, trying to get everybody ready for fall. We're going to start off this first one. We're going to discuss movement, different types of exercise, but really movement in general. We're going to go over some of the facts, the figures, why it's so important. We know it's important, but we're going to go over why it's so important. And then also things that you can do to create the routine and the habits for doing this. So we're going to start off with our Bible verse, Ecclesiastes 3:1. For everything there is a season, a time for every activity under the sun. And isn't that so true? Fall is, one of my favorite times of the year, not just because my birthday's in December. Hint, hint. Summer's a great time. We have a lot of fun, with our families. There's a lot of fun activities, vacations, holidays, things, we just finished up with Labor Day here. So, but it's really kind of getting back into your routine. We can really kind of get thrown off with start back up to school. And then, like I said, even getting, with Labor Day, start of the fall football season, fantasy, you name whatever it is. I love fall as a time of harvest. We talk about, in faith, it's a time for harvesting souls. And I think that's so true. There's such a revival going on right now that is so important. I'm so excited. I'm seeing it in our young people. So blessed. My son just chose to get baptized this past Sunday. So I've got to brag on, my boy Bryden there with that, and so many young people that are doing that. So it's such an important time. But with Harvest 2, I wanted to start with movement, something that you can just begin to do and create a habit and a routine that can be healthy with that. So, movement is absolutely essential for our bodies. It's what you're designed to do. And in our modern world, there's so many just sedentary things. You're sitting at a desk, sitting in cars, sitting on a couch, reading your phones, looking at things. So according to the World Health Organization, a sedentary lifestyle is one of the key leading risk factors for global mortality. And it's linked to things like heart disease, diabetes, and cancer. So the good news is movement's going to help mitigate a lot of these risks with this. So regular exercise and physical activity is shown to help decrease chronic disease, improve mental health, enhance mobility, and it can even increase your lifespan. I've mentioned this before, but it bears mentioning again. Something even, when I was young Dr. Brad in practicing, starting in my mid-20s, I always looked at, I'd look at the guys and to see what are they doing, at that point, guys in their 40s, 60s, 80s, 90s, the ones that were healthy and vibrant and I want to be like them. I'd ask them, what are you doing? And it was always, they stayed active, physically active, mentally active, spiritually active. They always had something, projects, their honey-do lists were longer than anyone's. And they loved it. And usually they were doing stuff, they were volunteering and they were doing stuff at church or going back to work, starting a new career, something like that. So that movement activity is so, so vitally important. So let's go through some of the benefits of movement. Improves cardiovascular health. Obviously there's a positive impact on heart health. Things like walking, jogging, cycling, swimming are very effective. Strengthens the heart, improves circulation, and lowers blood pressure. According to a study in the Journal of the American Heart Association, engaging in at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous activity each week can lead to significantly lower risk of heart disease. So, once again, you're breaking that down 30 minutes, 5 days a week. If you're going to go for more vigorous types of activities, you don't even need as much time with that. The other things, next thing is boost mental health and reduces stress. It's not just good for your body, it's good for your mind. I think we all know that. It's a good walk. Some exercise is going to release endorphins. The thought of doing it, knowing you're going to do it, getting into routine, you're going to release dopamine. And that's the happy drug. So it's going to reduce anxiety, depression, improve your mood, enhance cognitive function, which with all the cognitive decline and things that we're seeing, there are a lot of risk factors that behavioral and lifestyle modifications can really help to try and mitigate some of the cognitive decline. And having been through that and seen that in my family, with my father-in-law, I don't wish that on anyone. And I know it's so much more common. I'll do anything I can to not try and put my wife Lori through that. So I can't, there's no guarantees, but man, if you're going to go down swinging, fight as hard as we can. So, the next thing that it's going to help is support in weight management. Obviously, exercise is going to help by burning more calories, building muscle mass, and it's going to increase your resting metabolic rate. So there's different things: strength training, getting into high intensity interval training, but even daily walking is very effective for maintaining a proper healthy weight. Just get in that routine of doing things. Try and combine, obviously a healthy exercise routine and habits with a healthy diet is going to be the most effective strategy, and that's why we're going to go over that later. Another thing that it's going to help with is it enhances bone and joint health. Weight-bearing exercises, walking, running, strength training are crucial for bone health. We see so much. I see it in practice all the time. Osteopenia and then osteoporosis with people tends to be more prevalent in women, especially postmenopausal women, that we're going to see those things. So we're seeing a lot of, we try and help people, and there are some outstanding nutritional supplement protocols before you're getting on some of these medications that can have so many different side effects. So that's another story. We'll go over that at some point. But just the exercise, start with that. That's something that if you can do that regularly, that can definitely help with bone density. Improves quality of sleep. It's going to help you sleep better. There's a study in the Sleep Foundation, research from them, that moderate aerobic exercise increases the amount of sleep you get, which is the deep sleep that you get, with that. And that is the most physically restorative type of sleep. You're getting into REM sleep, but you're getting into the deep sleep. You're getting into the different waves, alpha, beta, but you're getting into the delta and getting into REM sleep. And those are when your body's really being restored, rebuilding, being replenished. So that's if you can get into those, that's what's going to help you feel more alert, or if you're not, you're going to feel more sleepy with that. And then, as I mentioned, increased longevity. That's something when you look at, rarely do you see somebody in their 90s that is obese. And there's a reason for that. So if you can try and set some of those habits, I joke about, I enjoy playing golf. Don't get to play as much as I would like a lot of people this season, as I mentioned, seasons of life. But I like to walk, as frequently as I can. And it's always interesting to me. You see some of these guys in their 70s and 80s, and they walk 4 or 5 days a week. There is not a single one of them that are obese. And there's a reason for that. So that's if they find something that they enjoy, they can do that. Same thing. You go out, you see people hiking. Rarely are you going to see somebody that does that regularly that is significantly overweight. So find something that you enjoy and that you want to do regularly. In fact, regular exercise has been linked to a 30% reduction in mortality risk from all causes. So that's not worth it. I don't know what is. So as I said, let's go through some different examples with this. Walking or hiking. Start with that. I mentioned this before in the podcast. I used to sleep on walking, and the benefits. Mine was, first it had to be, sprinting, running for football, track, and then went through a season of marathons, and I was pushing myself, and I wanted to have a certain time to go out and walk, and through different life experiences, I was definitely humbled to whether it was a physical thing, a life experience, health, what have you, that caused me to need to be able to walk. Maybe it's just time, a 30-minute walk, 20-minute walk, is something that is great for cardiovascular health, allows you to be out in nature, get out, enjoy what God has blessed us with. So it's good physically and also mentally. Strength training is the next one, terrific for building muscle mass. That's also going to support metabolism and bone health. Metabolism is even your resting metabolic rate. So that's the great thing with strength training. And it doesn't have to be squatting, thousands of pounds, bench pressing a school bus, anything like that. If you can sometimes even just some body weight things that you're doing, squats, lunges, pull-ups, planks, things like that can be done at home. You can go to a gym. There's different machines. There's different resistance that you can have as you're doing some of your cardio. And if you don't know, take a class. There's all kinds of classes now. There's body pump things. There's boot camps. I see it all the time. I think it's Silver Sneakers I'll see in the gym, and I'll see groups in there, and it's packed out with seniors that are in there, and they're doing different types of things. Some are using machines. Some are in classes. They're having fun, and it's very social, but it's doing a lot of benefit. So try and aim for that. Do that at least 2 sessions a week where you're doing some sort of strength training, and try and hit all major muscle groups. Unless you're bodybuilding, I'm a big fan of trying to hit, especially schedule wise. If I get busy in life and I can at least hit one full body workout a week, I know that I'm at least maintaining muscle mass things that I'm doing. If you can do more than that, that's terrific. But that's the nice thing with that. If you just say, hey, I'm going to do arm day on Monday because that's the easiest, and then life gets busy and that's all you did, well, you've neglected the majority of your body by doing that. So next example, yoga or Pilates. Love that. That's another thing. Flexibility is so important. When you look at health and you're looking at physical activity, strength, cardiovascular, but flexibility is another vital part of that. So those are excellent for flexibility, but also strength and stress relief. Study in the International Journal of Yoga found that yoga practice is associated with improved mental health, reduced anxiety, and better quality of life. So many benefits with that. And then, as I mentioned, if you're wanting to, if your personality is such that you want more high intensity interval training, short bursts of those things can be followed by, rest or low intensity exercise. Very, very efficient, very time efficient. I know there's times that if I'm busy, I'll do some HIIT workouts. I'll even sometimes finish up with a Tabata workout. And that's something that, a HIIT workout, you might need as little as 20 minutes, a lot less rest, just high intensity and kind of moving around. You can do that with your body weight exercises. There's times where I'll do that with, push-ups, pull-ups, squats, and then some sort of hinge. It doesn't have to be a heavy deadlift. It can be a kettlebell swing, something like that. And I'll just rotate through those, no rest, and, figure out how many sets I want to do of those things, and just keep going. And, 20 minutes, I'll do things even 12 to 15 minutes at a time if I'm kind of in a time crunch. So that's a great thing. Another example, dancing, cycling, swimming. Dancing, I love that one. When I was going through some of my research for this, I think of one of our patients, Miss Ann. I hope you're listening, Miss Ann, to this. I'm going to give you a shout out. Miss Ann, I won't say how old she is, but Miss Ann is rocking it. She is in amazing shape, looks great, bubbly, full of energy, and she's done competitive dance for I don't know how many years. She even trains with one of her instructors, one of the guys that was on Dancing with the Stars. So high level, just like I said, great activity, great role model. I said guys, but man, she's always been a role model to me for that. So keep doing what you're doing, Miss Ann. We love you. Appreciate your support and being a great role model for us on that. So in order to kind of get started with this, and the fall is a great time to start with this, couple ideas. Set realistic goals. Start with small, achievable goals. Instead of thinking, I'm going to go out and run for an hour, think I'm going to go for a 10-minute walk after lunch. And that's a great time. There is some terrific research after lunch, after a meal, going for a 10-minute walk. It is compounded, the effects that's having it by timing it. By doing there, you're going to, it's going to help with digestion. It's going to speed up metabolism. There are many benefits to doing that. Find an exercise buddy. This is, find friends for a lot of things that we do and engage in that. Have an accountability partner. This is something even, when we're studying things in Ecclesiastes and even some of the stuff in the New Testament, Paul talks about having a partner. You can, on your own, we can be under attack, and whether it's a physical attack from, lack of health, through poor food choices, but spiritual attack, and when you have multiple people together, you're stronger. They're going to have times where you're going to be weak. If you can have somebody that can keep you accountable, you help them when they're weak and vice versa. You're going to accomplish so much more together, and it's just more fun. So mix it up too. Try and do different things. Anything can get, I don't care how much fun it is, can get old and stale. So mix it up. Have different types of workouts. Do different movements too. It's also great so you're not getting repetitive use injuries. You'll see different types of tendinitis and things like that from doing the same stuff. Runner's knee, IT band syndrome, piriformis syndrome, lateral medial epicondylitis in your elbows from too much tennis, too much golf, same movements. If you're doing something like that, pick another cardio activity that is completely different, a completely different movement, so that you're using different muscles in different ways. And then listen to your body. There's times I've become a fan of recently on my walks of having a weighted vest. And, it's the same amount of time that I have, but it definitely kicks off. I'll throw a 40-pound weight vest on. Started with 20, slowly built my way up with that. I listen to my body, and there's days that I feel, hey, boy, I'm ready to get after it. Weight vest is going on. Other days I think, I don't even know if I feel like walking. I'm just going to get out there. I'm proud of myself that I got out there just to walk. And my accountability buddy is my dog Dutch, and he's at the front door, encouraging me to go. So listen to your body, and as long as you do something in that time span, you may just stretch, you may just use a foam roller, do something in that time that will keep you kind of on task. That's going to make it a habit, and the more consistent you are, the better results you're going to get. So, concluding up with this, moving exercise regularly are some of the best things that you can do. It's great for the heart, boosting your mood, increasing longevity, decrease different types of sickness and disease. You don't have to start big. Just start small. Just get going. Just be consistent with this. So thank you so much for joining me today on this. Like I said, this is part 1, movement. Part 2, I'm going to tease it a little bit. I've got a special guest. I've got a great friend, a friend I've had for years, just magnetic personality. And he's going to be joining me going over, and we're going to talk about the carnivore diet. I've had so many people message me, ask me, patients are asking me, friends are asking me, let's give me some more details. They know I've been doing it for about 16 months now. And that when they're saying, how do you look so young? Exercise, movement is great. Yes, genes help. Diet is huge. Diet and I will say the functional medicine, the part of getting your drainage, lymphatic drainage, and getting your body functioning optimally. But the diet part's going to be great. So I'm super excited for that interview. You're going to love it. Don't miss it. Try out these tips that I gave you today on part 1 on movement, and let me know what you think. Take care.